Flow. This station is all about health education and communicating with your patient. A good way to establish your patient's understanding is to ask them to repeat the instructions back to you. You can rehearse some key sentences to help you with the structure of your presentation. However, make sure you're ready to answer any questions that may be asked. Good afternoon.
Good afternoon.
My name's Julie. I'm one of the nurses here looking after you this afternoon. Can I just double check your name, please?
It's Helen Gray.
And your date of birth?
It's 6th of June 1950.
Okay. And what would you like to be called?
Helen, please.
Helen. Okay. Helen, can I just double check that with my notes and your wristband?
Okay.
Okay, so Helen Craig, 6th of June 1950, hospital number is F001001HC. Okay, I see you've got a red wristband here, Helen. Do you have any allergies at all?
Yes, I'm allergic to penicillin.
Okay, what happens when you take penicillin?
I get rash all over my body and my throat swells up.
Okay, we'll make sure that you don't get any penicillin whilst you're here. It is documented on your notes, and you do have a red allergy band, so that should alert everybody.
Okay.
So do you have any other allergies at all, Helen?
No.
Do you suffer from hay fever or anything like that?
Yes, I do suffer from hay fever,
Okay.
but not.
I see from your notes that you have asthma as well.
Yes.
So one of the reasons that I've come here this afternoon is to demonstrate the peak flow meter with you. Have you seen one of those before?
I've just seen, but have not used it.
You've not used one of these. So this is one of the peak flows. Okay. It's going to take about 10 minutes to do this. Is it now a convenient time?
Yes.
You don't need to use a washroom or anything before we start?
No, I'm fine.
Okay. So have you used one of these before, Helen?
I haven't used them.
Okay, so what this is essentially a basic tool to measure your lung capacity, so how much you can fill your lungs with air and expel that air, and to see whether or not your medication you're using for your asthma, so your inhalers, is sufficient for you. Is that okay?
Okay.
So first of all, have you had your inhalers this morning?
Yes.
You have, okay. Because it's important that we get a good measurement before and after your medication twice a day. So once we've shown you how to do this, we would like you to keep a record of your measurements before your medication in the morning, half an hour after your medication in the morning, and then before your medication at night, and again half an hour at night. Does that make sense?
That does.
Okay, so let me explain this machine to you, or device to you. It's a very simple device. On the ward you may well see us using it. When we use it on the ward, we will use these disposable mouthpieces and the same machine that we will use on the ward. But when you get issued one to take home with you, it will be your own one, and you'll have one of these plastic mouthpieces which is reusable. This machine will be solely for you and to be used by you and not to be shared by anyone else, okay? So, the principal parts of the device are, we have a mouthpiece, as I explained, and then the chamber. There is a slide mechanism on the chamber, but it's very important that you don't obstruct with your fingers, and make sure you don't obstruct the vents at the end as well, okay?
Okay.
So the best placed position to take this in is actually standing. But if you can't stand, make sure that you're sitting upright and your neck isn't flexed or extended, okay? So neutral position of your head. You need to hold the device at right angles, so horizontally. You need to take a deep breath in and make a seal around the mouthpiece, and then making sure that the arrow is back to 0. You need to expel that air in a short, sharp puff. So it's not a long, prolonged puff like you blow in a balloon or anything. It's a short, sharp puff, as hard and as fast as you can. Right angles, horizontally, sharp breath in, and as deep and as hard as you can. That will make this slider slide up, and we're going to record what the measurement has got. We need you to do that 3 times, Helen, okay?
Okay.
Are you with me so far?
Yes.
Okay, so When you've taken your 3 readings, you need to take the highest one, and that would be your measurement for that day. Okay? However, can you see that these measurements are done in litres per minute? They're worth 10 each. If there is a greater difference of 40 between your 3 readings, so say you got 300, 350 and 360, there's a 50 difference between the first and the second reading, so that's greater than 50. We'd need you to do 2 more to make sure that we've got an accurate reading. Okay, so it would be the best of 5 in that case instead of the best of 3.
Okay.
Okay? So, I would like you to demonstrate how you can do that for me and do 3 readings. Is that okay?
Okay.
So, Helen, could I ask you to explain back to me what position must you hold the device in?
Upright.
Horizontally, yeah, horizontally. And where would you hold your hands?
Away from the plunger.
Away, yeah, lovely. And how are you going to sit or stand?
If I can, I would stand. If I can't, then I will sit upright.
Lovely, lovely. So do you feel up to having a go?
Okay.
So if we can do best of 3 readings for you, is that okay?
Yes, that's
So
fine.
here we go, there's the meter. Okay, so we got 250 there, Helen, on your first one. Well done. That was a good short, sharp puff. One more. Again, 260. And one last final one. Okay, 240. So 260 is your highest reading there, Helen. So I'm going to plot that on here. So, how old are you, Helen? Remind me.
69 years old.
69. And do you know how tall you are?
Yes, 165 centimeters.
165 centimetres. So that says here that your expected value, what we're aiming for you to get, would be 370. Okay, so that's a little bit above from what you're getting at the moment, but this is the first time you're using the technique, and you've just had your medication change. So that's the whole reason why we're doing this, to make sure you're on it's sufficient enough. You might need to up your dose and things like that. So don't worry about the one-off readings. This is what we're aiming for. This is what someone, who doesn't suffer from asthma we would expect them to get to, and things like that. So this is what we're aiming for. Don't panic. We don't have to be there yet. Okay. Okay. So. Are you happy with best out of 3 and when you need to do best out of 5?
Yes.
Okay. And you need to do it morning and night, before and after your medication. Okay. So let me just tell you a little bit more about looking after and maintaining your device. Okay. So after each use, if you have some alcohol wipes, you just need to clean them with some alcohol wipes. And if you don't have some alcohol wipes, just general soap and water, and let them drain naturally to dry on the draining board. Okay.
Okay.
Then after every 30 uses, you need to do a thorough cleaning with soap and water, and then use some sterilising solution.
Okay.
So something similar to Milton or something like that, that we use for the sterilising baby bottles.
Oh,
Yep.
I know them.
Yeah, so something like that, at least once a month. So after 30 uses, you need to do that, sterilise it, okay?
Okay.
And then at the end of 12 months, after 12 months, so after a year, you need to discard it.
Okay.
And your GP will be able to arrange a replacement for you.
Oh, that's
okay. All right, so don't let anyone else use it. It will be your own device. And make sure that you do wash it, clean it after every use, and sterilise it every 30 uses, and then that will keep it working properly for you.
Okay.
Okay? Are you happy with what we've gone through there?
Yes, that is quite a bit of information, but
Yeah.
I think I've got it.
Okay, so whilst you remain on the ward as an inpatient, we will be helping you to do this before and after your medication, so that by the time you go home, you're fully au fait with it and it's all up and running. Is that okay?
Okay.
Okay, I'm going to take this away now, and we'll let you be. Can I get you a drink before I go?
No, I'm fine. I have a drink.
Okay. Anything else at all?
No, I'm okay.
Okay, so this is your call bell. I'm going to make sure you you can have that. I'm going to open the curtains and do my hand hygiene. And I will be around if you need anything, Helen, okay?
Okay.
Okay, see you soon.
Thank you.